I beg leave to ask the question on the order paper standing in my name.
We recognise that some people have struggled to access timely care from their general practice. We are taking action to expand general practice teams to increase the availability of appointments, upgrade practice telephone systems and publish data about how practices are performing so that patients can make informed choices when registering and commissioners can help services to improve. In 2022, 9 out of 10 patients felt their needs were met at the last general practice appointment.
My Lords, the latest GP patient survey shows that more than 1 in 4 of those needing an appointment actually avoid making one because it's just too difficult. So does the Noble Lord the Minister accept that practices like being made to ring at 8 a.m, long phone queues, waiting hours for a callback and no online booking all stack up more serious problems for the patient and the National Health Service? So what is the government doing to tackle these very basic practices so that people can get to their GP in a way that suits them?
Absolutely. One of the things that I'm very proud to be leading actually on the NHS side is this, our whole digital way of addressing access to the health service. And I think this will be fundamental in terms of how people make their hospital appointments and take control of their own health. So this will be the main thing that will help on the 8 a.m. Yes, it will, the 8 a.m. Morning appointments, and also, of course, the increased telephony services and everything else. But just as every walk of life is coming down to, at your fingertips, being able to make appointments, making your own bookings, getting your own records, this will also be the case in the GP surgeries, and I think it will fundamentally change the way that we address our whole health.
My Lords.
No mobile phone signal. So, and those people who live or who have homes in Cornwall would identify with that. But does the Minister have any idea what proportion of patients find accessing their GP difficult, and what advice has been given to practitioners on resolving the issue? And in rural areas such as Cornwall and Northumberland, there are poor bus services, if any, and getting home can mean a really long wait, and sometimes half a day if there are only 2 a day. What advice would the Minister give the GP, and what advice the patient?
Firstly, my understanding is that most homes in the vast majority of homes in Cornwall have broadband for which your mobile phone will of course connect to, and that's where they will be making their appointments from. So that's how they can use the digital to do that. Secondly, I'd say that we're rapidly increasing the number of doctors' appointments. We made a pledge to increase the number of appointments by 50 million, and to date we've increased it by 36 million. So 11% up since 2019. So we are making more appointments available. Do we want to be doing more? Absolutely. Are we going to be publishing a primary care plan shortly to show how we're going to address those additional needs? Yes.
My Lord, I draw attention. My registered interests. Deprived communities often have the most acute shortages of general practitioners. Yet it's amongst those populations that there is the greatest burden of chronic comorbidity that requires integrated care with a particular focus in the community, and where the outcomes are poorest and the healthy life years are the shortest. What does His Majesty's government propose to do about addressing this specific issue in deprived communities and GP shortage?
Yeah. Well, as mentioned, firstly, we are increasing the number of doctors. We've actually got about 2,000 more doctors versus 2019, and again, the House will be very pleased to know that is a key part of the workforce plan, again, in terms of how we're going to recruit and retain more doctors. In terms of the comorbidities and the deprived areas, clearly that's the role of the integrated care boards, and they've set up very much to understand the needs of their areas and make sure that they're properly looked after. And in a lot of cases, that is absolutely investing in the primary care. We all know that a lot of the reason why we have a lot of people in A&E is because they can't get the GP-type services. And so getting upstream of that issue and putting the investment in primary care is absolutely the direction we need to go.
My Lords, has the Minister Oh, sorry.
My Lords, it's often forgotten that general practitioners, unlike NHS doctors who are salaried, are self-employed contractors under contracts for services. What plans, if any, does the government have to review the existing GP contract to ensure that new terms are imposed to require better delivery of services by general practitioners?
So my understanding is that the new GP contract is part of live conversations with the BMA as we're about to get into them. I think it's coming over the summer where those negotiations start to take place. And within all of that, we will be looking at all those sorts of things in terms of what we want to see the GP service evolve to. And at the same time, be talking openly to the BMA in terms of what they want for their doctors, so that we get an outcome which works well for both sides.
Lawrence, has the Minister seen the report today produced by the Auditor General for Scotland, which is devastating about every aspect of the NHS in Scotland, including access to GPs? How much of this is the responsibility because of the underfunding by the UK Tory government, and how much because of the devastating administration of the Scottish government?
You're going to dare me? Sorry, my noble ladies dare me. I think it's probably a diplomatic response. It's probably wise at this stage. I would note, though, that under the Barnett formula, actually the funding for the NHS in Scotland is higher per person than it is in England. So they have got significant funding that goes in place. How well it is administered north of the border, that's probably a matter for the Scottish Government.
My Lords, is it not the case that many European countries actually charge patients who fail to turn up for appointments without due cause? Is this something that we're going to look at in this country?
I am clearly aware of that. At the same time, I'm very aware that we want to make sure that people are able to see doctors when they need to, and there isn't any deterrence on that. And so I think it's something that personally, I think we'd be very, we'd have to tread very carefully, and it's definitely not in the plans at the moment.
My Lords, given that a dual system of online and in-person GP interactions is inevitably the future, and that virtual appointments are clinically appropriate in some circumstances, what is government doing to increase public confidence in virtual interactions with their GPs? And how will it ensure that all triage systems don't disadvantage those groups who are less likely to vocalise their preference or indeed to advocate for the urgency of their own needs?
Absolutely. So for me, one of the key benefits of digital approach is the triage system. So we all know a lot of people calling at 8 a.m. in the morning for an appointment actually could probably be very well served by the pharmacy or a physio service or nursing. And so the proper triage of that through a digital type system is, I think, a really big step forward, which will then end up with them being able to make the appointment with the pharmacy or the physio or the GP in that case. Of course, what that will also do is free up resources so that those people who aren't able to access digital services are able to get through at 8 a.m. in the morning and so speak to a person in that case. So I really believe there's a win-win on both sides, and personally I'm very excited to actually take the House through later on in the year to see all the services that will be launched.
Lords.
Following on from the Noble Lord the Minister's previous answer, can I ask him what steps the government is taking to develop the profession of care navigator, that skilled staff who can make sure that people are directed to the right resource, whether that's a GP, nurse or pharmacist? Some people can use digital, but for others it's a personal contact that they'll need for that direction process.
Absolutely, and I know a lot of the best trusts that I've seen and visited actually have that right at their front door as well, because that applies to A&E also. And it's one of the first comments I made when I joined, when we said about how we're expanding pharmacy services, and that's brilliant, and that's part of the increase we're seeing. But if we're not telling people when they should go there, under what circumstances, then how is that going to help? So yes, absolutely, there will be both a digital and an analogue navigation.
Well, the Minister referred to the generous provision of finance for Scotland through the Barnett formula. In that case, does he accept the underfunding of Wales by the Barnett formula, which has been recognised by a committee of this House? And does he recognise, therefore, that the pressures of the health service in Wales, which the government in Cardiff is facing, is a direct consequence of that underfunding?
Again, my understanding is that Wales, also under the formula, receives more funding than England per NHS person. I'm pretty sure I'm right on that. I will confirm if I'm wrong, but I'm pretty sure I am correct on that. So I think it would show that both the Welsh and Scottish governments have more funding than the English ones. Whether they get better outcomes, I think we all know I'd rather be living in England, let me put it that way.